Welcome everyone, and thank you for joining us today for this forum on understanding grief. My name is Farah and I will be your MC. Before we start, a couple of housekeeping matters. Please turn your mobile phones on silent. If you require the facilities, they are to your right down the corridor. And in case of an emergency, the meeting point is on the oval across the road. I'd like to start by acknowledging that we are meeting on Noongar land and to pay my respects to traditional owners of this land and their elders past and present and to their culture. I'd also like to thank our sponsor today, the Melville Baha'i community. I'd like to extend a warm welcome to you and to those on Livestream for joining us today. And of course, I'd like to say a special welcome to our wonderful presenters who will share with us their professional and personal insights. The format of today's event is such that each of our speakers will present and then we will open the floor for questions and answers. Today's event is part of a quarterly series of mental health and wellbeing forums where we explore relevant topics with the help of expert panel members. Baha'i communities all over the world are working to engage in social discourses on topics that are impacting individuals, communities, and society at large. The program today will be video and audio recorded, and the material will be shared on Mind and Soul Matters YouTube channel, as well as on Baha'i blog. Some of the photos and material will also be shared on our social media. You can also find a number of previous forum presentations on the Mind and Soul Matters podcast. We're here today to explore a topic that is deeply human, yet often difficult to talk about: grief. Grief is something we will all experience in one form or another. It doesn't only follow the loss of a loved one, it can arise from many kinds of change. Loss of health, relationships, identity, or even expectations about how life should be. And while it's universal, grief is also profoundly personal. Understanding grief begins with allowing space for it. It also means acknowledging that grief doesn't need to be fixed. Instead, it asks to be witnessed, supported, and understood with patience and compassion. Today's forum is an opportunity to do just that, to listen, share, and to gain insights on what grief looks like and how we can support ourselves and others. So whether you're here as someone who is grieving, supporting someone else, or simply wanting to understand more, there is much we can learn together. With that, I would like to introduce our first panelist, Dr. Mojdeh Basiri. Dr. Basiri is a trained psychiatrist who completed her medical degree at the University of Western Australia and continued to complete her advanced training with the Royal Australian and New Zealand College of Psychiatrists. After the completion of her specialist training as a psychiatrist, Mojdeh worked in public community mental health and has been in private practice for the past 12 years. Mojdeh's work with patients almost always includes exploring grief alongside addressing other mental health conditions, recognizing the importance of this deeply meaningful aspect of an individual's experience. Outside of work, Mojdeh devotes her time to family and friends, enjoys gardening, reading poetry, and improving her art skills. Please help me in welcoming Dr. Mojdeh Basiri.
Good afternoon. I'd like to begin by acknowledging the traditional custodians of this land, the Whadjuk Noongar people, and pay my respects to elders past and present. I've been asked to share some of my thoughts on grief. I have less than 30 minutes, which is not long for this important topic. My challenge has been selecting what I've found valuable in understanding grief for myself, but also for my studies and my work. Hopefully something of what I'm about to share with you will help in some small way today. Grief is a given. Each of us have faced loss and grief, and each grief story is unique. As Elizabeth Kubler-Ross has said, our grief is as individual as our lives. I worry that in our modern society, we focus on being happy, fixing our negative emotions. We quickly turn our attention to the positive side, busying ourselves with distractions, and hence we risk making grief a taboo subject, either avoiding it or pathologizing it. Grief is not a disease, it's a necessity. There is no shortcuts. It's not a destination, it's a process. It comes and goes with attention, oscillating to and from the pain. The only way through grief is to grieve. Those around us and those who came before us can have key insights into understanding grief, and we can become experts of our own grief in time. I will start with some definitions, and I want to mainly focus on the grief associated with bereavement. I will then discuss when grief becomes more complicated and how it differs from depression and the tasks involved in grief. This is a quote attributed to the late Queen Elizabeth. Grief is the price we pay for love. When we lose something or someone that we love, we grieve. It's as simple as that. Loss can take many forms. The American author Judith Voice describes loss beautifully. Our loss includes not only our separations and departures from those we love, but our conscious and unconscious losses of romantic dreams, impossible expectations, illusions of freedom and power, illusions of safety, and the loss of our younger self. If we look at loss in more concrete ways, it can involve the loss of a significant person, whether it be a family member or a friend, the loss of an external object, our pets, our belongings, loss of part of ourselves through physical illness or disability, fertility, or our senses. Social status and roles can be grieved and lost. And in terms of the psyche, our self-esteem, our ideals, freedom and independence are also important areas. In the wider community, the loss of religion and culture is an important growing issue. And of course, there are developmental losses. They are invariable and inevitable part of life. So, for instance, the role of a child becoming an adolescent, leaving school, marriages, divorce, having children, retirement, old age. Some losses can be actual and some can be symbolic. For instance, a loss of a job, which is an actual job, actual loss, can also be accompanied by symbolic losses such as self-esteem or career aspirations. Some people might be surprised that seemingly positive life events, such as marriage or parenthood, can also contain a level of loss. For instance, the loss of freedom or the loss of sleep in the case of having children. So our developmental stages all contain a level of grief work. Bereavement refers to the fact that there's been a loss of a special person, of someone that we have a close attachment to. Grief is our internal response to loss. It's how we feel it emotionally, how we process it cognitively, our physical responses to loss, and our behavioural responses. And mourning is more the external expression of our grief. How we mourn is informed by our culture and social systems. Some mourning rituals are done privately, whilst others are done as a community. Rituals such as attending a funeral, a wake, memorial services, sorry business, wearing black or white attire, sharing a prayer, singing, dancing rituals. These are all very important in mourning. It's interesting that some of these ancient cultural practices have continued, whilst others have been banished, only to resurge again. For instance, the Gaelic cultural practice of keening involved women or highly respected community members chanting sounds, screeches, as well as improvised verses about the deceased life and their deeds, and was often accompanied by body movements like rocking and beating the chest. From my point of view, I can really appreciate how these kind of rituals can be therapeutic in allowing a form of physical release from the pain, helping regulate our emotions and bypassing words when words are just not enough sometimes. Dr. Elizabeth Kubler-Ross was an American psychiatrist and considered a pioneer in grief research and palliative care. From her work with patients with terminal illnesses, she described 5 stages of grief, and some of you might be quite familiar with these. Denial, anger, bargaining, depression, and acceptance. Denial is essentially the very first often confronted reality. It's that sense of shock, feeling numb, our difficulty in refusing to believe that the loss has really occurred. It's a defense mechanism that we use to protect our psyche from being overwhelmed. And then as the shock fades, the pain surfaces, and often it's expressed in anger and resentment. And the anger can be directed towards ourselves, towards doctors or caregivers, towards family, friends, or even the deceased. Bargaining is another defense mechanism that we use in order to gain control. We start fantasizing about the what ifs and if only. It's a form of magical thinking when we bargain with higher power or the universe to undo our loss. For instance, I'll become a better person if my loved one returns, or my pain ends. Or if only I had done some specific thing, my loved one would still be here today. And then there's depression. This is when we connect with the sadness and the realization of the finality of the loss. Now, with acceptance, sometimes this stage is misinterpreted. People often think acceptance means that we're okay with the loss. Mostly, people are not really okay with the loss. It's just that we have accepted the loss and we find ways to move forwards. However, there is no linear path, and we don't all have to go through all these stages. There's no formula for grief. People can skip steps or repeat them in a loop. Also, these painful emotions can be separated by periods of peace, calm, relief, love, joy, and that's all healthy. Some of us may not have experienced such an emotional roller coaster, but these better periods are a good sign of adaptive long-term outcomes. David Kessler worked with Elizabeth Kubler-Ross after she suffered a number of strokes and was paralysed. The two of them wrote a book together, Two Experts on Death and Dying. Over a decade later, David experienced the death of his 21-year-old son, and this prompted him to expand on her work by adding a 6th stage to grief, the importance of meaning in grief. Only the individual can find or create meaning. It's not about trying to understand the loss or rationalise it, but what you do with your grief. It takes months or years to develop. Meaning is made through relationships, through rituals, memory, and narrative integration. Meaning can take the form of creating ways to honour our loved ones, such as setting up a foundation or continuing with projects, supporting others who are in pain, living in a way that honours the loved one's values, reconsidering our own values, and sharing stories or memories. Bonanno was another important researcher in grief. He is a professor of clinical psychology who conducted 2 decades of research of bereaved individuals and provided more insights into the process of grief. He identified 4 categories of disrupted functioning during grief: cognitive disorganisation, dysphoric emotions, health deficits, and disruptions in social and occupational functioning. Cognitive disorganisation basically describes the sense of confusion, preoccupation with memories of the deceased, difficulty accepting the reality, a sense of derealisation, as if the world is not quite real, difficulties concentrating, making decisions, changes in identity, the bereaved individuals describing part of themselves missing, or adopting personality features of the deceased. Dysphoric emotions are the ones that we know well, all too well, that of sadness, irritability, fear, guilt, loneliness, emptiness, shame. Importantly, Bonanno also recognised the link in health outcomes in bereaved individuals. Grief is acute stress which affects all organ systems. So we know that bereaved individuals often have increased doctor visits. They report palpitations, shortness of breath, chest tightness, poor appetite, fatigue, insomnia, restlessness, high incidence of heart problems, what's been referred to the broken heart syndrome. This risk is highest in the 6 months post-bereavement and improves over time. And of course, there's disrupted social and occupational roles. So often bereaved individuals withdraw socially. They report greater difficulty at work and with parenting. His research was important as it identified that resilience is the most common response to grief. Resilient people struggle initially. They do feel the pain and use internal and external resources to help support their distress, and they're able to maintain relatively stable levels of functioning. For instance, working, parenting, and they can have capacity to have positive emotions. Outside of the resilient outcome, Bonanno also described 3 other outcomes. The first one being that those with moderate or high levels of stress, for instance, those who actually develop depression or PTSD, but they subsequently recover. Then there's about 10% of people who develop what's called prolonged grief disorder. And then there's a delayed grief reaction, when individuals appear to function normally initially and may not initially show any overt signs of grief, but later develop intense distress. This is a grief jar metaphor that I personally like, and I think it really shows and validates grief beautifully. It was devised by Dr. Louise Tonkin, and it shows that grief doesn't shrink in time. That ball just sits there. However, our capacity, we are the jar, to contain our grief grows over time. Of course, there are going to be times where our capacity shrinks again and the pain seems quite large, and these might occur at times of anniversary reactions or other reminders. Another useful concept that I've come across is the dual process model of grief. And it shows how grief involves oscillating between 2 processes. So there's loss-oriented processes of actually sitting with the pain, mourning, looking at photos of our loved one, yearning, sitting with the sadness. And there's restoration-oriented pathways of adapting to life without our loved ones, practicing skills of learning new skills and adapting to a new identity. And the fact is that we don't do these things in tandem or linearly. We oscillate between the 2, and it normalises that we need breaks from grief. It can be exhausting to be constantly grieving. And it also shows this ambivalence that we all have about wanting to hold on to our loved ones, hold on to our pain, but also to move on. And that's fairly universal. Moving on to the prolonged grief disorder, which previously was used interchangeably with other titles such as complicated grief or traumatic grief. And again, we have to remember that this only happens in a minority of bereaved, around 10%. And it's characterised by distressing symptoms that continue for at least 12 months following the loss of a close attachment. For children, we have a lower threshold, so we would use 6 months as the cutoff. And it's characterised either by intense yearning or longing to be with the deceased, intense preoccupation with thoughts and memories of the deceased, and various other criteria. So again, for those who are interested, DSM specifically specifies 3 out of 8 criteria. So things like feeling as though part of ourself has died, a sense of disbelief about the death, avoidance of reminders that the person has died, often coupled with intense searching for things that remind the person of the deceased one. Intense emotional pain, difficulty reintegrating into life, numbness, feeling that life is meaningless, and intense loneliness as a result of the death. Some people perceive grief as frightening, shameful, and they also worry that if their grief lessens, their bond with their loved one ends. Some people believe that by enjoying life, they're betraying their lost ones. And that's really important. So who develops prolonged grief disorder? The way that we look at this is we classify people and their presentation into different categories. For instance, their pre-loss risk factors. So this is what each person uniquely, the kind of risk factors they bring into the equation. So we know that being female, being older, from a lower socioeconomic status, and having a close relationship to the person who's died increases your risk. In particular, a romantic partner or a death of a child are particularly painful. And of course, pre-existing history of mental health conditions such as mood or anxiety disorders increases our risk, and so does childhood adversity and multiple losses. The loss-related factors which increase prolonged grief relate to the death being sudden or unexpected, being violent, accidents or suicides. And of course, post-loss factors which increase the individual's risk of developing a prolonged grief disorder or lack of social support. Prolonged grief disorder is a serious condition. It causes personal distress and suffering, and it interferes with functioning. It's associated with long-term adverse physical ill health, such as heart conditions, autoimmune conditions and cancers, as well as psychological outcomes because of the prolonged nature of stress response in the body. 75% of people have comorbid psychiatric conditions such as major depression, PTSD and anxiety, as well as alcohol and substance use. Professional support is indicated in this group, and effective treatment include therapy, which is coming to terms with a loss, accepting the reality, and changing the relationship with the deceased internally, reducing avoidance, re-narrating our lives, and strategies to manage the intense emotions. And of course, looking at ways of restoring that person's ongoing satisfaction in life, in re-engaging in activities, goal setting, thinking about the future, and reconnecting with others. There's most likely going to be a role for medications to help reduce anxiety, improve mood or sleep, and of course addressing substance use if it's indicated. Major depression is another condition seen in bereaved. So again, the DSM-5 classification of major depression involves a diminished or irritable mood and or decreased interest or pleasure in activities, as well as other associated symptoms, such as feelings of guilt or worthlessness, loss of energy, difficulties with concentration, thoughts about death and suicidal ideations, changes in appetite and weight, psychomotor retardation, as in motor restlessness or slowing, and difficulties with sleep. For the diagnosis of major depression, we're talking about this pervasive sense of low mood that's there daily for at least 2 weeks, and it's causing significant personal distress and functional impairment. Grief and major depression do look similar. They may even co-occur, but there are some differences. The sadness, crying, depression, of course, can be seen in both. However, in major depression, the depressed mood is more pervasive. It's across all contexts, and there's an inability to anticipate happiness or pleasure. However, in grief, there's pangs of pain. It comes and goes because of either internal reminders or external reminders of the deceased. But people who are grieving can generally also have positive emotions, and the humour is preserved. The content of thoughts in major depression are focused on negative thoughts about the self, about the world, about the others. There's this persistent self-loathing and negativity. Whereas in grief, the preoccupation is mainly with memories of the deceased, and self-esteem is preserved. And avoidance is another different pattern. So in major depression, avoidance consists of general social withdrawal, low motivation, loss of enjoyment in pretty much everything. Whereas in grief, avoidance is limited to reminders of their loved ones and their loss. Treatment of depression in this context includes a personalised approach with a combination of medications and therapy. Whilst the focus of my talk has been on bereavement grief, I want to briefly mention a couple of other important areas of grief that are not so well recognised. Ambiguous loss. There are complicated life situations where we might be unclear if loss has really happened or it has not. Is the loss permanent or temporary? The person might be here physically, but they're not there mentally. For instance, in the case of a loved one with dementia or severe addiction or severe mental illnesses, or in the case of a missing person, it's a limbo. It's very painful. It's very difficult to get closure, and it can really complicate the grieving process. The term disenfranchised grief is grief that is not openly acknowledged, socially validated, or publicly mourned. Examples include suicide. There's been a taboo of suicide historically in our culture, and unfortunately, it still continues. And it's unfortunately, it leaves those bereaved by suicide feeling quite marginalised and isolated. Women who've had miscarriages or terminations were not previously recognised as legitimate grievers. Young children and people with intellectual disability can also be often overlooked. In addition, death of other important relationships, such as death of a teacher, death of mentors or ex-spouse or a pet, can be considered disenfranchised grief. Migrants, so again, despite their wish to migrate to improve their quality of life, they're not allowed to tell their stories of the old country and grief in their resettlement. And older people losing their independence, freedom, or self-esteem, again, face a level of disenfranchised grief. I also just want to talk briefly about how grief presents in people with autism. It's not well researched, but it's increasingly identified, and it's an important area to consider. The following areas have been noted to be specific challenges for people with autism, that because of their delayed emotional responses, bereaved individuals might appear unaffected at first. People with autism often feel emotions more intensely, but they have difficulties identifying their emotions and communicating them. A term called alexithymia In addition, difficulties with their emotional regulation means that sometimes it comes across as having meltdowns or just becoming increasingly socially withdrawn. Grief can result in increased sensory sensitivity and increased repetitive behaviours or stimming. And difficulties with focus, organisation are also commonly reported. And again, people on the autism spectrum can also become very hyperfixated or ruminative with their deceased, and they have difficulty integrating it into their life history. They are going to be at a higher risk of developing prolonged grief disorders and anxiety and mood disorders. And it's really important to recognise that and to use clear language to describe what is going on for that individual. Trying to avoid ambiguity, validate their distress. It's important to allow time, and you might need to be repeating over and over again in different language what has happened. And each time the person may only be able to have limited capacity to absorb or process a certain amount of information. And of course, structured rituals are really important for the grief process. Now, grief has also been a huge catalyst for works of music, poetry, art, and literature. It's not surprising that the majority of artists and authors who have used this medium as a means of processing their own loss and memorialising their loved ones. My opening slide was called The Angel of Grief, and it was a work by William Story in 1894. He made the sculpture for the grave of his wife, and that was his way of memorialising her. Art can be a universal language of connection. It allows processing, sometimes non-verbally. This sculpture is called Melancholy. It's by a Romanian artist who created to represent the empty feeling of sorrow following the loss of a loved one after the artist himself lost his wife. As the Persian poet Rumi reminds us, the wound is where the light enters us. Many people turn to the world of art and literature to connect with their pain. They can gain comfort from a shared understanding. There is resonance, but people also use art and creativity to help with their own grief journey. So in terms of supports, obviously, there are lots of community supports out there who provide both individual as well as group counselling sessions. Our general practitioners are always a good starting point as well, and they can also either provide us with grief support, review the need for medications, but they can also refer on, using services such as a mental health care plan to access psychology or other specialist services. My two favourite bits of work. One is this book, which is really easy to read, and it's a very comprehensive book about all aspects of grief, written by Zita Annette Weber. And more recently, I've come across this little brochure, which you can actually download, and it was only published last year. It's called This Is Grief. Again, it's there right at the end. It's a gentle guide for individuals and families, and it was essentially commissioned by Palliative Care in Tasmania. And it's just a beautiful book that, again, I think would also appeal to younger children, because it's really very simplistically laid out with beautiful pictures. So in closing, I want to reiterate that grief is a psychological necessity. It can also be very painful work and looks different in each of us. We need to approach our grief with an open heart, accept the loss, feel it, and deal with the pain. We must adjust to a world without the deceased and find an enduring connection to them and find meaning in our lives. The cure for grief is to grieve. It's an active process and requires ability to adapt coping strategies to changing circumstances. The pain stays with us, but our capacity grows around it. Remember the grief jar analogy. There are going to be anniversary times where grief becomes reactivated again, and we have to swim over those waves of grief again. Encouragingly, resilience is the most common outcome. As a community, we can aspire to provide safe, reflective spaces to discuss grief and role model it across the wide spectrum of presentations. For those who are suffering with prolonged grief or depression or other forms of high distress, supports are available and recovery is possible. By talking about grief, reading about it and seeking support, we can integrate grief into our life history. For most of us, grief rewards us with deeper insights of ourselves and new perspectives of life, relationships and spirituality. I want to leave you with this last lovely quote from Elizabeth Kubler-Ross. She says, "The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths of this. These people have an appreciation, a sensitivity, an understanding of life that fills them with compassion, gentleness, and a deep loving concern. Beautiful people do not just happen." And that's the end of my presentation. Thank you.
Thank you very much, Mojde, for that very in-depth and comprehensive presentation. I'm sure you would agree there was so much useful information in there, and thankfully it's all been recorded, so you can go and on YouTube or Baha'i blog and watch this presentation again. Thank you very much. Our next presenter, and I like where Mojde ended, is that beautiful people are not just made, because David is one of those beautiful people. They don't just happen. David is a 42-year-old born, raised in Perth, a dedicated father of 2 young boys and a professional in the workplace health and safety industry. Beyond his work, he is deeply committed to community service and to raising his sons with care, strength, and compassion. In March last year, David lost his wife, Emma, to breast cancer. Today, he shares his lived experience of grief, resilience, and navigating life as a husband and father after loss. Through his story, he hopes to offer an honest and heartfelt perspective on what it means to keep moving forward while carrying love and loss side by side. Please help me welcome David.
Good afternoon, everyone. So in putting together my, sharing, I've sort of grouped the story I'll tell in sort of 3 broad areas. So firstly, what happened. So as Farah mentioned, Emma passed in March of 2025. So if we go back to March 2024, while we were at a doctor's office checking a blood test result for myself, we were almost walking out the door when Emma casually mentioned to the doctor that she was experiencing some discomfort in her right breast and just wanted to mention it. Emma was breastfeeding our 4-month-old son at that point and attributed that discomfort to a blocked milk duct. Nevertheless, our family doctor made a referral for an ultrasound, which Emma had a few days later. We were all basically thinking, it'll probably be nothing, it's good to check these things though. And the result of the ultrasound found an area of concern. And further testing led to a diagnosis nobody anticipated. So cancer in the breast and lymph nodes under the right arm. So over the next 12 months, Emma underwent chemotherapy and immunotherapy treatment for her cancer that at first was very responsive. It was showing encouraging signs to making a recovery. There were some complications along the way, and the treatment did take a physical toll on Emma. A few months into treatment, there was the formation of a further tumour in the same breast, and seemingly resistant to that course of treatment that Emma was having. And this necessitated the decision to bring forward a planned mastectomy of the right breast and removal of the lymph nodes. In the months that followed surgery, Emma completed the planned course of chemotherapy and then began radiotherapy, which was completed in January 2025. It was around the same time that Emma notified her oncologist about some pain she was experiencing in her back. And through some testing, there was confirmation of the spread of cancer to Emma's spine and liver. Emma's oncologist began a new treatment aimed at prolonging Emma's life for as long as possible. And, Emma fought bravely until her body could no longer do so. And in the early hours of March, the 19th of March, 2025, Emma departed this physical world. So how did it impact my life? You can see it now. But when Emma was diagnosed, the thought that she wouldn't get better, it never really entered my mind. I mean, we live in Australia. We have access to some of the best treatments in the world. Of course, it wouldn't be easy on Emma's body or mind, but I was always of the belief that she would make it through this challenge and continue to be the wonderful mother she was to our two boys. And this phase of life would be something we look back on and marvel at what a magnificent job Emma did in beating cancer. For me, thank you, one of the biggest impacts of losing Emma has been the loss of a partner. The loss of a partner that I consulted with constantly to try to make the best decisions possible. Whether that was in relatively simple day-to-day household decisions or significant ones to how we raise our sons, Emma's wisdom and foresight was something that I realised after she was gone that I would not be able to replace. Sure, I mean, I'm able to discuss things with other family members, but there was something that I always found in consulting with Emma that led to so much clarity on, what the way forward should be. Another impact that I felt at the time and still continue to feel is, Emma physically not being here to see our sons grow and develop. And this is coupled with not being sure how my sons will process and how our sons, will process the loss of Emma as they get older and achieve significant milestones in their life. Even things like how to navigate Mother's Day activities when your son's school focuses on honouring mums. And that being said, credit must go to my eldest son Levi's school in how they sensitively discuss these matters and ultimately aim to keep Levi's happiness and well-being at the forefront of any decision making. And so the last category I've put this presentation into is how did my faith and community help me with the grieving process? So the offers of genuine support that my family and I have received since Emma's passing have been so amazing and comforting. I have been able to have many conversations with people, and these have allowed me to explore my grief as well as being reassured that I'm not alone on this journey. My boys are not alone, and we have a network of support around us at all times. In terms of the community around me, this includes family, and it would not be right if I did not give a special mention to Emma's parents, Kamran and Roya Kazemi. We have lived together for many years, even before Emma's illness, and the love and support they have provided and continue to provide my boys and I have been so much that words will never be able to express the amount of thanks that it deserves. I mentioned specifically the impact of the physical loss and any sadness that this has caused in my life because it is quickly coupled with my spiritual beliefs as a Baha'i, that Emma's soul has progressed from this world to the other worlds of God. And when I feel sad about something Emma has not seen due to not being here in person, I quickly remember that my beliefs teach me that, and have taught me that Emma sees everything that is happening in mine and our boys' lives. She is just seeing it from her own vantage point. The teachings of the Baha'i faith remind us that death is not something to fear or be saddened by. And while I find myself at times wishing for Emma to still be here, I know that Emma's soul has progressed, and the journey that she had to take in this physical world happened for reasons beyond anyone's control or understanding, and therefore and should not be questioned. Instead of being saddened or ceasing to function, I'm aiming to do everything in honor of Emma and live with the mindset that she is with me and our boys every step of the way. Thank you.
Thank you, David, for that very honest and absolutely heartfelt sharing. We do have a tribute to Emma that we're just in the process of showing some photos with music. It's supposed to be accompanied by music, but if we don't have music, we'll still share the photos. I think Emma didn't like the music, maybe. I'll open the floor now for if anyone has any questions. There will be a roaming microphone going around, so please, if you have a question, raise your hand and Marijan will bring the microphone to you. Marijan, Sue has a question.
Thank you. This question is possibly addressed to Dr. Basiri. In respect to people with diverse cultural backgrounds, I've had personally, professionally actually, dealing with people coming from other countries facing PTSD. In the Western culture, usually you encourage them to see a psychologist and talk about the issues that has caused you problem. A lot of times, their symptoms are having insomnia, body ache, and depression or anger, and they are referred to doctors for body ache or insomnia and other issues that are physical. And traditionally, they are not inclined to talk to psychologists or psychiatrists at times about the emotional impact of traumas that they had endured, whether it was due to war or displacement or at times personal violence that they had endured in their past lives. And there is a taboo about going to psychologists and talk about their griefs, or if there is suicide in the family, that's even, as you mentioned, worse to talk about it. Also, personally, I've had friends who had family loss and they haven't been able to deal with it. And they see it, I'm not saying the term waste of time, but they always express that if I want to go and talk about the past wounds, I don't know, am I speaking too close to the microphone? This will bring me back to the traumas that I had experienced before. What is the use of opening the wounds that is becoming better? What is the use of opening the scars that I have endured? Even for coming to this gathering today, I encouraged somebody to come with me, and that person said, well, I can't handle opening the wounds again. Let me be what I am. I can understand that what you discussed about the grief, and sometimes people say, well, it's my grief and I like to have this grief. I can understand that we all have episodes, even if it's an old grief. Memories come back, or when you are lonely, or a beautiful scenery reminds you of what you have lost. We have our joys as well as our sorrows. And a lot of us can move on with our grief, and then at times the grief comes back as a spore, and then you go on carrying on with your dance or laughter or joke. But what suggestions do you have for people who are of that opinion that talking about it and bringing out, I know from the science of psychology, it's good to deal with it, face it, and then find solutions for it. But for people who are not familiar with this concept, what is the best thing that for us who are untrained in this field to help with our family members or ourselves at times?
Yeah, that's quite a thank you for asking that question. It's not an uncommon case. I have people who get referred to me. They might even attend for a first appointment, but it's quite clear from the outset that perhaps either they may not be ready to be talking about their grief or their trauma. They just don't feel safe, or they don't feel like they have the capacity to be able to address the feelings that they've essentially been, suppressing or repressing at times. I think it's important to really meet each person where they are, and I think it's important from the outset that whatever they do decide to do, that it's coming from them, and it is acceptable to them. In terms of, again, all you can do with reducing the stigma of seeing a counsellor or a psychiatrist if needed, is to really talk about it, trying to kind of educate and demystify the process, but also that for some people, perhaps we just need to actually learn to respect their limits. Maybe for them there might be some other more creative and maybe non-verbal ways of them dealing with their pain and their sorrow. So, for instance, with children, and specifically traumatised refugee children, play therapies, sound therapies. There's been a lot of research and innovative work done in terms of actually how play therapy can be used for children to actually be able to process their pain, and of course art therapy, or music therapy is another one, or working with the body. So again, for someone who really is reluctant to directly look at and revisit the old traumas or the grief, it may be more about doing it in a more creative outlet, or really just looking at their life goals. So again, more about their reintegration into the current life, and what's missing and what they would like to set goals for themselves. But there has to be buy-in. Otherwise, it's impossible, and there's got to be trust.
Thank you very much, Moshe. There's another question that's come through, which David touched on in terms of. I'll just wait for the microphone to be turned on. There was another question that's come through, which is what David touched on in terms of the community and the spiritual side of grieving. Whether David wants to elaborate in terms of how your spiritual beliefs and community specifically help through that, and also whether, Moshe, if there's any research, the scientific side in terms of our the spiritual side of things and community in assisting us through the grief process.
Shout out to my good friend Navid, who's tirelessly doing the AV. Thank you, Navid. I don't think the mic's high enough for his satisfaction. Are we good?
Yeah.
It's good? Fantastic. That gave me time to think about that answer. I mean, spiritually, I've reflected on this a few times during the journey with Emma's treatment, and certainly in the last 12 months or so, since March 25. As a Baha'i, and I sort of when I reflect, I sort of I've been a Baha'i sort of, I'm coming up to 15, 16 years, I think it might be now, since sort of 2010, and I sort of look at it in the sense that it's what you're training for your whole life in terms of grief, like the writings that I've read and the conversations that you have, and as I mentioned in my talk about death not being something to fear and being something to be saddened by, and it was never more evident through Emma's journey, from the point the way that Emma approached it with such, in terms of her, I guess, predicament with the illness, like with such detachment really early. Like it was, I remember we had a conversation where this can go one of two ways. Either I'm going to fight this and get better and or at the same time it's going to go the other way where there's no sort of turning back. But as I mentioned, sort of in those times, my faith and beliefs that these things need to happen. That we sort of God's wisdom and not questioning that spiritually, but then trying to reconcile it with the physical and the reality of, well, okay, the physical loss is going to be difficult to deal with, but I find every time I'm saddened by the physical, it's like there's this thought, like this spiritual sort of comfort that comes and say not to be, I guess, saddened for too long, and to know that these things need to happen, or have happened and need to happen for that reasons beyond my comprehension. So I think that maybe answers the. Yep, thank you.
Yeah, I mean, from my point of view, I always I always inquire about each person's specific spiritual beliefs. If they have some, it can be very encouraging, and I really would invite them to find comfort and peace in their religious or spiritual beliefs. And for most religions, there are specific ideas about what happens in the afterlife, or whether it's about reincarnation or whatever it is. So, and that could be quite a protective factor, and a real sense of comfort for a lot of people grieving and for their pain. However, at the same time, there's always going to be people who don't have any specific religious affiliations, and again, that's where I normally just try and get them to more openly think about the meaning of life more broadly in an existential sense, in a way. So if our bones and our flesh does disintegrate, which we know scientifically it does, what's left of us? What does that mean? And of course, we're all going to die. There are these kind of existential givens of life that all of us have to negotiate and find answers for. And each person then often goes and thinks about it and comes back, and they may have their own theories about it. I know, for instance, some of my patients have found the idea that, well, energy can neither be created nor destroyed. So they like to believe that there is an energy of their loved one that they can still connect to, which again, shares some of these themes. So I think it's very individual and unique, and it definitely is it provides a sense of joy and relief and peace for people to think beyond death, and whatever way we can encourage people to explore that, that's in a way that's acceptable to them, is the best way to do it.
Thank you. We'll have time for one more question, if anyone has a question they would like to ask.
Thank you. My question is for David, and I just want to acknowledge your courage as well in coming along today and sharing your journey. My question is, as a parent of 2 young children who at the time is processing your own grief as well as trying to coach your own children in processing what has happened, I just wonder what that experience was like for you.
Thank you, Gina, for the question. Yeah, it's been an interesting one. I was telling a couple of friends before we started today's forum, like when Emma passed, it wasn't for about 10 days or so before we told our oldest son Levi. He was 5 and a bit at the time, and that 10 or so days was really consulting with family, trying to get advice on how do you tell a 5, almost 6-year-old that mummy's not here anymore. He did have the many hospital visits, after school, weekends, etc. Knew that mummy wasn't well. Sort of had that basic comprehension. For Eli, our youngest, he was barely 12 months old, or I forget the maths now, but he was 16 months, I think it was. So it kind of in a way made it easier. It's like there's no real too much time dwelling on how to tell, because what we'll do is we'll just fill his life with memories of Emma, you know, as he grows and understands. And actually, I mean, short sort of side thing here that just came to mind, when Emma was being treated and Eli, our youngest was in the hospital, we'd always sort of say, you know, oh, because he was starting to talk, and we're like, oh, say mama, say something, you know, just to give Emma that, and he would always look at Emma and just smile and not say it. He wouldn't say mum or anything, but you get the booklets done for the memorial for the funeral service, and it has a picture of Emma, like one of those ones that were on there. And amazing, it's on the piano in our house. And one day, he just randomly walked up. Actually, he's not beyond waddling. Walked up and just looked, and he said, "Hi, Mama." And I went, that's, you know, how do you sort of, so he always kind of probably knew how to say it. He just was, you know, having a laugh with Emma. So, but in terms of how we, told Levi, we had to be very, I don't know, specific and use the right language. We had to say, you know, Mum died, you know, I know I've been saying passed a bit, but, and you know, sort of that sort of thing, but we had to say Mum died, she's, you know, not physically here anymore, and but you know, that she's basically, you know, sort of everywhere now. If you talk to her, she'll hear you. You know, that the sort of the spiritual side of bringing that, and that belief that, you know, Emma's soul is sort of amongst us in that way. So it was something we grappled with as a family for many days after. And even now, as Levi sort of continues to grow and mature and comprehend, he's processing. You can see he's processing it, and his mind's processing it in his own way. And it's I'm not saying it's easy to infuse Emma in the conversation, but it's more possible now than I say it was sort of 12 months ago, and it's becoming more natural now to and especially things like, you know, mum would be proud of something you've done in school, or, you know, and that what that sort of resonates or how that registers in his mind, I'm not sure, but just to keep reminding him, you know, that it is true. So thanks. Yeah.
Thank you very much for sharing that. Okay, a big thank you to the Baha'i community of Melville for hosting our panellists today, who were absolutely incredible and amazing. We're going away with our hearts full of love and I think grief as well, and a lot of information to process. Also, thank you to our AV guys and the Mental Health Forum's Organising Task Force, and our two special helpers today, Marijan and Mastana, who've stepped in. If anyone is interested in continuing this discourse in a more intimate setting, we have our in-house psychologist, Sarah McFarlane, who's waving. She will meet you at 4:30, so you have about 15 to 20 minutes to enjoy refreshments. She will meet you in the foyer to have a more intimate discussion in a small group setting. And that discussion will go for about half an hour. If you would like to have more information about upcoming events or the next forum, keep an eye out on the Melville Baha'i Instagram and Facebook pages. Our next forum will be on Sunday, 26th of July, on student and workplace wellbeing. So if your parents that have students that are anxious about anything or studies, or if you are in the workplace and want to get some tips on improving mental health in the workplace, please come along. Thank you again for being part of this important conversation, and please join us for some refreshments.